Hi, everyone. Welcome back to Fallopian Files, the visual podcast about all things woman for all womankind. I'm your host, Chistian C. I am joined today by Dr. Dzifa Avalime. Let me get my paper because I want to make sure that I get this correct. Hold on one second here. Okay. So Dzifa is an NYC native who recently moved back to New York to work as a women's health clinical pharmacist practitioner. Okay. Prior to coming back home, she studied chemistry at Pace University. She went and attended the best HBCU, Howard University, for pharmacy school and completed a PGY1 general pharmacy residency and a PGY2 in geriatrics. And she worked as a geriatric primary care pharmacist. Her transition to women's health has been enlightening and a great learning experience, and she hopes that every day she finds a day to make our women patients feel better and live better. So this is welcome, Dr. Avalime. Do you prefer if we call you Dzifa?
Yes.
Okay.
Just Dzifa's fine.
And please, anything else you want to add or anything else you want to say about yourself, please feel free.
Oh, I'm excited to be here.
All right. So thank you so much for joining us. And we wanted to bring on a pharmacist today so that we could actually have some conversations about different things related to medication, supplements, like different things that a lot of women take and hear about and think about. And you never really know what is real, how it works, if it works. So I think having somebody who is really an expert in their field and knows what they're talking about, as opposed to people just giving, their opinion on things, is such a great resource to have. So I'm so delighted that you're here with me today for us to have this conversation.
Thanks. Same. I hope I have some good insight. I mean, we'll see.
So tell us like you say you're a clinical pharmacist practitioner, a women's health clinical pharmacist practitioner. What does that mean?
Okay, so everybody probably, when you first think of pharmacists, like everybody's like, oh, the person who works at maybe like CVS or Walgreens, that's considered a retail pharmacist. And I would say all pharmacists are technically clinical, but you have also like industry pharmacists, so maybe pharmacists who work for Pfizer or Merck, things like that, where they maybe see a different side of the drug pricing and maybe doing more research-based things. And then you have maybe pharmacists who work in like PBM, which is like the pharmacy benefits side. So they do maybe like the prior authorizations for if you get a prescription, they're kind of working behind the scenes to make sure you get those meds approved. And then on the hospital side, you have also different levels. So you've got the inpatient, outpatient pharmacists, so maybe pharmacists who are physically inside of the pharmacy, like reviewing the IVs that the techs draw or reviewing the medications before they go out. So the outpatient side, similar to the retail side, but in the hospital setting. And then the inpatient side, they will be doing like the IVs and verifying all of those. And then you also have the clinical pharmacy specialists who maybe do more. You maybe have some who also work on the inpatient side or in specific specialties, so like infectious disease, ambulatory care, which is a lot more broad. So you could do like outpatient mental health, you could do women's health like I do, or you could do geriatrics, which I've done before, or cardiology. There's literally a plethora.
So many different specialties.
Yeah, so I tend to spend more time doing like one-on-one, and specifically within like the VA, I have like prescribing authority, so I can adjust people's medications on my own. So I tend to see patients being in the ambulatory care setting, but in women's health for like their diabetes, hypertension, high cholesterol, and then also like fertility and for women's health, and then prenatal, postnatal, all the between. Yes.
Okay.
Yeah.
I didn't know that there were so many different types of pharmacists. Like I've worked, so way a million years ago, before I was a nurse, I was a pharmacy tech, and I worked both retail. So I was at a CVS. I don't know if you're supposed to name drop these.
I know, right?
I was there at this place.
No free advertising.
Right. So I worked as a pharmacy tech in like a retail setting, and then I've also worked as a pharmacy tech in the hospital setting, where I was the one doing, like you were saying, like mixing IVs and delivering medications and stuff like that. So I knew there were clinical pharmacists. I couldn't tell you what they really did, but I knew that they were clinical pharmacists, and they were in like the different settings or areas of the hospital. So that's cool to know that, you know, you really could have done a lot of different things with pharmacy. It's not just going to the outpatient retail pharmacy and checking stuff. So that's cool. Well, definitely want to pick your brain about things related to women's health. And one of the areas that I wanted to talk to you about or get your opinion about really, so being, you know, the audience knows I've told them a million times I'm in my 40s, so I'm 41. And a lot of times when you're trying to make sure you're staying healthy and staying at your peak physical condition, you see a lot of things on like Instagram, TikTok, YouTube about a million different types of supplements and vitamins that you should be taking. You got sea moss, you got, you know, the mushroom powder mixtures that are supposed to help your brain. You got, you know, the collagen and all the things that you're going to add to every water. And you usually see people who describe themselves as like naturopathic type practitioners. But in my experience, I also knew that like a lot of pharmacists have this kind of information about the pharmaceutical benefits or aspects of these things. So can you talk a little bit about that? Like what kinds of things you know about like the natural medicines and vitamins and all that?
I have a hot take.
Okay.
Most of the supplements are nonsense.
That's what we need to know. That is what we need to know, because you know how much money we spend.
They are very expensive
on
urine.
These things, just expensive pee.
Yes.
You heard it here first.
Yeah. But it's really, okay, so there's like a mix, it's like a mixed bag, right? So there are good sides to supplements and there's also the bad sides. So I think I tend to tell people, like, if you're eating like well-rounded diet, you're drinking enough water, you're doing all those things, like you're getting your exercise, getting sunlight, all that stuff, all your labs are good, you probably don't need extra supplements. Now, being that, you know, most of us don't eat the way that we should and don't get all the nutrients that we need, that is where the supplements kind of come into play. And particularly for women, our hormones fluctuate so much throughout the month, especially if you're having, you know, regular periods, things like that, and you're having, and then even when you start to transition into perimenopause and then menopause, there are like supplements that can be beneficial for people who maybe are just not getting everything they need from their diet. Okay.
I'm picking up what you're putting down.
Yes.
All right.
So it's like, to me, it's always, I think people always are shocked when I say it, because I'm like, I actually prefer you to not take as many meds as possible. And they're like, but you're the drug person. And I'm like, okay. Yeah. Most things can be fixed if you just eat better. But from the supplement side, I usually tell people, if you're going to get supplements, make sure they're coming from a reputable source. So, you know, a lot of times you will look at, like, I won't name drop brands, but hopefully they can get you some sponsors. And then we could talk about them. But like, usually look for like the USP label. So it's like a little green and yellow label that you'll see on most bottles. And it just means that those medications or those supplements have been verified by the United States Pharmacopoeia, which is like similar to the FDA. It was
Okay.
a group of like pharmacists, doctors, nurses, like who do research to make sure that what is on the bottle is
What's
what is
actually
in there.
Gotcha.
And that also it is safe and effective.
Okay.
So like if you take a B12 vitamin or vitamin D, calcium, etc. Those are probably the biggest ones also that I recommend for women, just because a lot of us don't get enough sunlight.
That's for sure.
Yeah, and we don't always get enough B12 and like iron from our diets. So I would say those are probably the biggest ones, and they can, like iron particularly, especially if you're like having like regular menstrual cycles, like your iron, if you're having heavy bleeding, you probably will end up being low in some iron. So that could be helpful. Also, like B12 and vitamin D are really big for energy. And so a lot of people who say, hey, I've been really exhausted. I'm like, first thing, have you been like, have you gotten your labs checked? Do you know if you're vitamin D deficient? Do you know if your B12 is low? Iron, those are probably the three biggest ones that, especially women, that if they're low, that, the energy is, you're going to see that first in being more fatigued and probably being more fatigued around your period as well. And then
I think we definitely all experience that. That's for sure.
Yeah. And then transitioning into like perimenopause and menopause, like calcium, and usually calcium and vitamin D, because they're very important for the reabsorption for bones. And as we start to lose estrogen, the bones tend to become a little bit more brittle. So those are probably the biggest ones that I would say I like to recommend, but I usually tell people eat better first.
Okay. Because you hear a lot about making sure you have like a balanced diet and things of that nature, and there's all these different, if you don't, like myself, I've worked shift work, so I'm a night shifter by nature, so I definitely was not getting enough sun unless on vacation. But just really having options available, and then having the energy to meal prep and stuff like that.
Yeah, it's hard.
I tried some of those meal prep services. They're not bad. They're convenient.
But they don't always taste good.
They don't taste the best. I have to then add additional seasonings or something, and it's like, what is going on? Or I get bored with eating the same thing over and over and over again. But even then, it's hard to kind of tell, like, am I getting everything that I need? So I know they started, so I was sharing with the audience that I am also kind of going on a fertility journey myself. And so my GYN has had me on prenatal vitamins for a long while. And I know, especially if you're thinking about going down the journey of having kids, then they want you to have more like folic acid and stuff like that. So kind of why would they start you on a prenatal vitamin if really it's like it's just expensive pee?
Because you're probably not getting enough in your diet. That's usually it. So it's like half expensive pee, but also like can be beneficial because we're not absorbing a ton of it, even though we might be taking the supplements as well. Okay. So it's like 50-50 expensive pee. But the folic acid particularly, just to kind of boost those levels to make sure that, when it is time to get pregnant, or even during pregnancy, because you want to also take like a prenatal prior to getting pregnant, while you're pregnant, and then post-birth, especially if you're going to breastfeed, etc., because it helps to keep those levels high. But it's also important for that placental barrier, and then also for the baby, because you want their growth development kind of depends a lot on the folic acid. Okay. Now, I'm not going to lie and say that I can explain that whole
I know they usually
like
say something about like the neural
helps with that neural tube development. And so it helps make sure that, essentially that they are able to form fully the like brain barrier. And then also that they kind of help to, what's the word I'm looking for?
Like gut?
Yes, but that their organs develop properly. So and at the appropriate rate. So folic acid, I mean most prenatal vitamins also have some iron, calcium, B12, vitamin K, A, D, E, all the things. Which we should be getting from our diet and tend to not.
Okay. Okay, so I'll keep taking it.
Yes,
then.
Keep taking it. I think you should keep taking it because without it probably not getting enough generally. So.
Now, can it hurt if people are taking all these supplements, or is it is it just that you possibly are not absorbing these things that you're taking and flushing it out of your system, or is it something that people should be aware of that maybe taking these supplements could have, side effects if you don't need them?
I don't know if I would say it can hurt, but if you're already getting enough, then you don't necessarily need more. So it's not that it hurts, but it could just kind of be a waste. And they tend to be expensive also, especially if you're getting like the kind of some of the non-generic ones, like the brand name ones, like the liquid ones or things like some of those. I think it's not necessarily a waste. There's sometimes like you can get, if you're taking like a calcium supplement or something that has like potassium in it, if you start to take too much potassium can cause like your heart rate to increase. Too much calcium can start to also cause some imbalances with your sodium, with your potassium. And so they all kind of work interchangeably. So it's kind of a fine line, but because you may not absorb a ton, it's not that straightforward. So it's like if you are taking extra supplements and everything's okay, it's like, okay, you might be good for a while, but especially as we get older, the metabolism starts to slow down. So if your calcium is normal and now you're taking calcium every day and now it's starting to creep up
because your body can't clear it as fast as it used to.
Yeah, so it's kind of like a fine balance.
That makes sense. So if you're taking supplements, then really you should be making sure that you're going to the doctor to get your labs checked.
Yes.
So they can make sure your levels are good.
Yes.
Because you don't want cardiac issues, heart rhythm issues. And definitely you can feel it like musculoskeletal.
Oh, yeah.
Like if you get a lot of cramps and stuff in your body, go to the doctor, get your levels checked because you could be
for sure
off with one of your electrolytes or something like that. So, so that's like vitamins. But what about things like the mushrooms for brain health or... Or like the sea moss. I know the sea moss girlies are real out here. I've tried it. I've blended it up in the house
in the
and
smoothies
stuff, and the
all
smoothies, What about things like that?
Okay, I don't hate them. I just like things like mushrooms, like some of the like herbs are finicky because there's a reason why some of the like bigger brands that are staples that are like USP certified don't make certain supplements because they may not be shelf staple.
Gotcha.
So I tell people who are like, oh, I really want to take like some of the like mushroom capsules or things like that, like just go eat the mushroom. You could just go eat the mushroom.
But do you have to eat like a whole bushel of mushrooms
the thing is,
to get the same effect?
To probably, so there's like some of the like I think they're like the nootropic mushroom ones that people use for like ADHD and things like that. Those are a little different because they have done testing on like specific strains of mushroom to see how they affect the brain.
Oh, okay.
But like some of the capsules that people take don't always have the adequate amount that you might need to take. And so like you said, like even if you had to eat a bunch of mushrooms, you might also need to take like 4 or 5 of those capsules daily to get this effect that you should be getting. I don't know. It's it's a hard one because I'm probably gonna say it a lot. It's like yes, but also no,
right.
Because It really is.
There's
like
nuances to all of it. Yeah.
Because there's also with some of the like the herbs and supplements, especially like the mushrooms for brain health, or like there's a popular memory one that people take. That's super expensive, and I saw a lot in geriatrics. Like they're like, oh, should I buy this?
Yeah.
Everybody says it's great for memory and health, and I'm like, I would look at the ingredients. I'm like, oh, it's a bunch of like things you could just get in food, like vitamin K, like it's like, you know, like things you could get from spinach, like things like that. So,
but they don't tell us. Like most, well, like you and I know because we've taken courses for our career of what things have those types of vitamins and stuff in it.
Yes,
but there's not a lot for like the regular layperson to know. Like, oh, I just ate 3 servings of spinach, so I actually got a good amount of
your daily serving of vitamin K.
Yeah, so you wouldn't know if your food is actually giving you that. So that's something to maybe think about as you all are listening to this. Talking with your doctors, even dietitians, nutritionists, they should be able to give you information on what types of vitamins are available in your food, so then you know when you're eating that it's actually benefiting.
Talk to your pharmacist. Talk to your local friendly pharmacist.
Exactly. See? I'm a big proponent. Every time I would go into the pharmacy, if I got any new supplements that I was buying on the shelf, or if I started any medications, like I always would talk to the pharmacist, because even some of the doctors I used to work with who, I remember I worked with this one ER doctor, and he was like, when I went to med school, there were like 4 antibiotics.
Yes.
He was like, that was it. He's like, you want me to know these 900 antibiotics now? He's like, that's why I call the pharmacist. So I was like, you know what? That is smart. He was like, that's what they do, what they know. So, he was like, what I don't know, I go to the pharmacist. Yeah. So I was like, that's true.
Yeah, I mean, we spend 4 years, like, literally just studying drugs and how they work on the body.
Who else to go to? So, okay, so I want to ask as well then, when we were talking about, I'm going to be doing a series within the show called The F Word, which is going to be talking about fertility journey. And so definitely I'm going to be bringing you back to talk more about that, and especially as I start my process with using the medications and stuff. But I was telling a little bit about my journey with birth control and how I went from trying birth control pills, the ring, the NuvaRing, the patch.
I'm a big
IUD.
proponent of the NuvaRing.
You like the NuvaRing? I was telling them I hated it.
Really? I'm sorry, y'all.
I really hated it. Only because it would end up on the other side of the room.
Oh. Okay.
It would just...
You can take it out before you do anything.
So you can take it out
just before,
but okay, so why do you like the NuvaRing? I need to hear this. Why do you like the NuvaRing?
I like the NuvaRing for people who forget to take the oral pills. For people who forget to take the pills. For people who maybe are like, I would say like baby testing, like maybe getting an IUD.
Okay.
And then also for people who maybe like people who just are kind of moving around a lot, and they're like, okay, I just want something that I don't have to worry about for a couple weeks, but I'm like nervous to just go into getting like the implant or going to get an IUD. So I like it for that. And it has, I would say, generally minimal side effects. I mean, you have the regular birth control side effects that everybody is at risk for. So, the weight gain, mood swings. But generally, I've seen a lot of people have success with the NuvaRing. And you can take it out before like sexual activity for 3 hours. I would say 3 hours, no more than 3 hours.
So you got to set a timer. I'm supposed to know. What? I mean, what if I want to have a marathon that day, Dzifa?
Well, then take it out, put it back in, and then take it out again. I don't know. That seems a little... I don't know. Or just check that it's still there later. Check it's still there later.
Wait, okay, so like with the side effects though, so because I know with like the pill and stuff like that is like a systemic, you got to wait for it to absorb through your stomach, get into the bloodstream, all of that. Is it the same type of absorption with like the NuvaRing, or is it more local because it's down there?
Sort of. It's still systemic. It just it's similar to like if you were to put like a patch on, so like the patch as well.
I didn't like the patch.
Yeah,
either.
a lot of people don't. The patch actually has like I think one of the highest risks of weight gain. That the depot shot. Yeah, I don't have great feedback for people from those, but
your clothes lint gets on it, and it looks like a dirty Band-Aid, and you're like, this is really sexy.
And then people find that it starts to peel off too soon.
Yes.
Yeah.
Who came up with that?
A man. Probably.
100%.
Probably a man.
100%. Because that's
probably
not practical at all.
No.
Okay. So which ones have less side effects? Or I guess they all kind of have similar side effects, but is there any that you would say these ones tend to have less side effects and these ones tend to have more that you've seen?
I would say on the lower end, you've got like the non-hormonal, like the copper IUD, which just emits copper ions to help regulate your cycle. So
I didn't even know that it's releasing ions.
Yes.
Okay.
Yes, it releases copper ions consistently.
Okay.
And so that's essentially how it keeps you from getting pregnant.
Oh.
Yeah. I mean, the chance...
Do you have to worry about that? Like copper buildup
no,
or anything?
No, not unless you have a sensitivity to copper. I don't know how often physicians are checking that people don't have a copper sensitivity.
Okay.
I don't know.
There's something good to know now as well. Copper sensitivity. I didn't even know that was a thing.
Well,
copper sensitivity.
Yeah.
Okay.
Well, because it's going in you. I mean, I think people who maybe have like certain metal sensitivities maybe would want to stay away from a copper IUD.
Oh, like if you know she had reaction to like piercings and stuff like that. Okay.
Yeah. So that one. So those are on the lower end. Then I would say the NuvaRing, and then depending on the oral contraceptive, so the lower doses of the estrogen progesterone combinations, so I think like that's the Yaz or Scythia, like I mean they all have girl names, so so those ones, and then I think like Camilla, way too many girl names. I have a chart that I keep so that I can make sure that I'm like looking at the right ones,
right.
And then the ones that probably have more side effects is like anything that's progesterone only. So like the depot shot has most people tend to have weight gain is usually the biggest one with progesterone only, and then the oral progesterone only. I think that's
okay. I remember I heard a lot of people would talk about hair growth with depot.
Yes,
that they would get like a lot of body hair.
Oh, yeah. Yeah.
So,
yeah, because I've like heard it, but I didn't know it was that common.
Yeah.
So I'm not gonna lie to you, I didn't know it was that common, but I think it kind of makes sense. So with for somebody who maybe has like PCOS, we may not do progesterone only because they already are having like an imbalance of progesterone. Okay. Yeah. And so that usually people tend to already have the hair issue. So because you're just doing progesterone, that makes sense that you would have more hair growth. Yeah.
Okay.
Yeah. So
well, that's good to know.
Hair can come up in weird places. Might have a little bit more chest hair. Might have more chin hair. Because it can mess with the balance of like testosterone as well.
Okay.
So
that makes sense.
Yeah. So kind of they work on similar pathways. So more testosterone buildup will kind of lead to that hair growth.
Progesterone and testosterone work on the same similar pathways.
Yeah.
Oh, that's good to know. I didn't know that either. See, I learned so much from you. But if you are on it and you do experience these types of side effects, if you come off it, will they reverse? Or do you have to do different things to get yourself back to normal?
It's kind of different for everyone. So some people, it could be, it also depends how long you were taking them, because with most drugs, to be honest, side effects can come like whether you're on year 0 or you're on year 5.
Okay.
So there's
they
people
can pop
who,
up at any time.
yeah. So especially because, you know, so much of our hormones and things like that are changing.
Mm-hmm.
If you are, if you're on like a birth control, like you may be fine for the first like 3 years, and then all of a sudden it's like, oh, I'm having like all these weird cravings, etc. And it's like, well, I'm not pregnant, but but it could just be maybe like now you need a higher dose of the estrogen in comparison to the progesterone. So yeah, I say it really could depend. For some people, you could come off of it and then be immediately it's like, oh, the hair's like started to fall out and then it's gone.
Yeah.
But for some people it might take a little bit. But I would say for anybody who maybe starts something and they start to experience any side effects, like if you want to come off of it, like tell your doctor first, and then, you know, kind of discuss if it's something that's severe, right? Like immediately maybe stop. Like if you're starting to have like heart palpitations, whatever, like just stop it. But, you know, let your doctor know, and then you might need to do some additional testing afterwards to make sure that everything is okay. The balance, yeah.
Okay, that's good information to know and things. So it makes sense now, the different experiences that I had with the different types of birth control. Ultimately, I ended up doing an IUD, a hormonal IUD, which, you know, really was not fun putting in. And I was actually asleep when they took it out because I had to have surgeries. So they were able to take it out while I was under anesthesia. Yeah. But I
wish they did. I mean, nowadays more and more they're doing like local anesthesia and things like that, but that was not always the case.
No, and it was not fun going in. I was like, this better be worth it. Yeah. So, and also with the IUDs, I think mine, I don't think it fused totally, but I think it was a little fused to my lining, which I don't know how often that happens.
I think that's fairly rare. I want to say it's like 1 to 3%. I have to fact check that, but I think it's around like 1 to 3% of it like fusing. Same with like people getting pregnant on with an IUD and the baby being
holding it in their head.
So those are also like fairly rare. I think that one's maybe like 3 to 5% of people, but it's pretty rare, I would say, or fairly rare.
Yeah. Oh gosh. Okay.
But you think about it, it's like it's implanted in there, and then you're shedding lining, and then it's regrowing essentially, and so it kind of makes sense that maybe you would have like more people develop like scar tissue around it.
Okay. Yeah, that makes sense as well. Okay. So we're gonna pivot from things to stop pregnancy to now the supplements that are supposed to like get your libido back up, keep you all like wet, like, you know, who knows what out here, like a waterfall out here in these streets. Those
most people just need to drink more water. Like most people just need to drink more water.
Because you see so many, like you see what's the one that's I think what's it called, like the ashwagandha, or the what's it called,
the who?
Okay, somebody in the background trying to tell me something. What are you trying to say? Oh, like
the tree, the willow bark, no.
I know what you're talking about, but I can't think of it either. It's drink some Gatorade.
No, legit. A lot of people just need more electrolytes and need more.
Is it like elm bark or something?
Slippery elm.
We finally got it. Slippery elm. Is that like how between those, the ashwagandhas, the what's the one that starts with an M? Maca root. Yeah.
They can be good.
Supposed to keep you horny and keep you, you know, slippery.
Some people find success. There's like mixed studies on all of them. Like honestly, people are probably gonna watch this and be like, should I take a supplement? Should I not? And be like, well, you she said maybe. Like,
there was no firm answer.
Because it's kind of like hit or miss for some people. Like, they might take the maca and like feel great and feel like it's like helping them with feeling more like sexually the desire. Ooh, I'm sorry. Feeling like the desire is increased. For some people, it's like, oh, okay, this didn't change anything. Yeah. So it's like hit or miss with a lot of them, but like on the hydration aspect, most people really just need more water. Just need more water. Like, try that first. I think that my issue with the supplements is a lot of people don't try the dietary changes first, and then they kind of want like a medication fix. And then they maybe like blame that they're like, the doctor just wants to give me all of this, and it's like, well, I actually wanted you to try some lifestyle changes first, and you
those
refuse.
Are the hardest to do, though.
It is. It's easier to just like pop a pill, but even sometimes like a lot of the supplements and a lot of the medications don't work because people are not adequately hydrated. They're not. Metabolism is not where it needs to be to even absorb a lot of it, which is why it tends to be expensive pee, because you're not even absorbing most of it because you don't have the adequate nutrients already to absorb. To take it in. So it's like, it's all connected.
So like I remember I had someone I think it was like a trainer tell me once that whatever your body weight is in like number, divide that by 2, and that's how many like ounces of water you should be drinking. Is that still about?
Yeah, pretty much. Yeah, pretty much.
So how it'll fluctuate based on your weight. There's no like, oh, let me just drink this liter or this gallon of water. Yeah, it's really based on your weight and how active you are. Yeah, pretty much. And stuff as well.
I would say at baseline though, most people probably need to drink a gallon a day, like at baseline.
And I know people are not doing that.
No.
I see. There are times when I definitely, and I try to drink more water, but I definitely have, the big water bottle I'll take to work, and it will still be at the same level that it was when I got, when I left home, and it's like I didn't drink any of that, and then now I'm expected to be like,
yeah.
So okay, so that makes sense. Yeah. Drink the water. Then and eat the diet. Yeah. Move your body.
Yeah, that's a big one too, because it's like a lot of times, a lot of the issues are because we're not moving enough, and most of us sit at a desk all day, or like we only do a commute walking to the car and then drive
train.
And then
exactly. So. Okay, and then the one last thing I want to ask you about, because I know especially with this becoming more widely available across the country, but I know marijuana has had some impacts on your hormone levels for men and women. Yeah. I know, and we'll talk about more in depth when we do the F Word series, but I remember the fertility doctors even asking myself and my then partner, did we use marijuana at all because it can have hormonal effects on men? Like, kind of, I guess it can be more estrogen.
Yeah, so I think it can cause like symptoms of impotence also. So causing like, it making it harder to get hard and have an erection and maintain an erection. And then also there's more and more studies coming out. So like there's not enough information just yet on how it affects like the viability of some of like the sperm as well. And then same with affecting like estrogen and the levels throughout pregnancy or even pre-pregnancy. So there's more studies coming out trying to figure out like, okay, how exactly does it affect? Because so we have cannabinoid receptors throughout our body already. Okay. So like we have them all throughout our body. Depending on the strains too of marijuana, they can target different receptors. So like certain strains make you sleepier, certain strains make you more certain strains make you feel more like hallucinogenic. So like they have different effects also on the hormones. We're just not sure quite yet of like how much affects. Yeah.
Okay. But can it interact with like if you're on medication or things like that? Like how from what you've seen with the study so far, because I know there's a lot of usage of it, whether between smoking or tinctures or, edibles, whatever. And I know people use it for arousal sometimes as well. So I just kind of want to give a little from the scientific pharmaceutical side, side of it, just kind of what people should look out for, or if they should have their doctors check different levels if they are using. Because I know sometimes you don't want to go to the doctor and say,
and tell them,
I smoke weed. And then they'll be like, oh, let me mark that in their chart. Like, oh, druggy. So people are reluctant
to
say share
anything.
that. And it could also have an impact on your body, your hormones, and all of that. So what can you share in terms of that?
Well, I think, like, with that, and even with supplements, I say just be honest, like with your doctor, like just tell them, like, because especially with some of the supplements, like there's like people like to take things like ginkgo and garlic, and those can increase the risk for bleeding. And so if you're already having, like, from a woman perspective, if you're having heavy periods and you're taking like a ginkgo, garlic, like ginseng combination every day, and you're like, my periods have gotten really, really heavy, it's like,
that could be
and you're not telling your doctor, and they're just like, okay, well, let's start this medication, when really we could just get rid of the supplement, but you didn't know that,
right?
Because they didn't know that. So from that aspect, I think just being honest first. As far as levels, I mean, just like, please just go to the doctor, like get your labs done, like yearly, like, and just be honest if you're smoking, what you're smoking. Also making sure you're getting like marijuana from a reputable place, because there can be things mixed in. I think it tends to be the where a lot of the risk comes in, or the interactions maybe, is when maybe there's other things that could be mixed in. I think with... And it really just depends also on the strains. It also depends how often you're smoking, how much you're smoking. And with the strains of, like, things that maybe make you more hallucinogenic, you might, if you're having, like, memory issues and they're trying to figure out, like, oh, we want to put you on a memory medication, which tends to happen to a lot of women as we get older. It's like, no, maybe you just need to pull back on smoking, or maybe you need to figure out, okay, is this strain maybe a different one? Because some people find benefit for pain, for the cramps as well. So I think it's
been used to help forever with, like, cancer,
for cancer pain,
and stuff
for
like that.
Appetite. So I think it starts
like,
at being honest.
Are there strains that you would typically tell women to kind of avoid, or is it just really person to person?
I don't know if that I've had that much experience, so I can't say that I necessarily tell anyone what to avoid. I usually ask, though, especially when I see, like, our maternity patients, like, hey, do you smoke anything? Or when they tell me, like, hey, I'm having issues with and not producing enough milk, particularly. I first ask, like, do you smoke? Like, are you, like, drinking? Are you trying to pump and dump? Like, are you getting enough water? Like, all those things. I think, I'll have to kind of maybe look more and see if I should be telling people, like, certain strains to stay away from. But for now, I haven't, just because I just don't have the experience or knowledge, I guess, there.
But it's good, like you said, to at least be upfront and honest. I always would tell people, like, that at the very least, there's two people I don't lie to, my therapist and my doctor. Like, everything else, we'll figure it out from there. But 100%, I don't lie to my therapist, and I don't lie to my doctor, because if I can't figure out what's going on with me and you don't have all of the information, then we could be throwing stuff to the wall, see what sticks, and like you said, when it could just be some factors of maybe coming back on something or trying different things. But that's good to know, because I didn't even know that certain strains could possibly have more of an impact. It's not even necessarily just marijuana as a whole, but it could be the strain or type that you're using. So that's good to know. And, that's why I wanted to ask, because I'm like, people think all the time, like, oh, the pharmacist is just sitting there counting pills. They don't know anything.
I haven't counted a pill in years. To be honest, like
Exactly, but you'd be the person to ask about these types of things. So I really appreciate you coming on today and just giving some of your insight. And like I said, definitely I'm going to have you back to talk more about the fertility drug aspect. And I'm going to have some different guests on talking about other things related to women's health. So I definitely, from the medication side, would love for you to come back.
I'll bring some studies for the fertility ones because those will be more like in-depth. We'll do, for sure.
Absolutely. And even have you, along with some of the other guests, like definitely going to have a reproductive endocrinologist and gynecologist come on. So hopefully we can have you back with some other guests as well, because I think your input and your expertise from the medication side is what most people are really lacking.
It's unique. It is unique.
It is. And you don't even think about it. Like, I should have a pharmacist that I could talk to and know different things. So
it's funny. The pharmacists actually are your most accessible healthcare person.
This is true, because I could go to the corner, and talk to somebody.
There's pharmacies everywhere. Yeah, independent pharmacies. You can walk in and ask them.
This is true. This is true.
Most accessible healthcare person.
Go to your pharmacist, ask questions about your medication, let them know what you're taking.
And if we don't know the answer, we know how to find it.
Exactly. As most professionals do, they're going to go and look, research, and get back to you. So if they don't know, that doesn't mean that, they're useless. They may just not know right now, but they're going to know next time you come back. So thank you so much for joining. And thank you all for sticking around and listening to our conversation. And definitely we'll see you next time.
Keep on listening.